Pregnancy is a life-changing experience, physically and emotionally. For women with scoliosis, or even those with mild, undiagnosed spinal curves, pregnancy presents a unique set of challenges. As the body adapts to support a growing baby, significant changes in hormones, weight distribution, posture, activity levels, and diet can all impact the stability of the spine. While many women with scoliosis go on to have healthy pregnancies and deliveries, it's important to understand how these changes can affect the scoliosis condition, both during and after pregnancy. Hormonal shifts: relaxin, estrogen, and progesterone. One of the most profound effects of pregnancy is the surge in hormones designed to prepare the body for childbirth. Among these, relaxin plays a key role. Relaxin's main job is to loosen the ligaments of the pelvis so that the body can accommodate labor and delivery. However, relaxin doesn't just target the pelvis. It affects ligaments throughout the entire body, including those supporting the spine. For women with scoliosis, this can be problematic. If the spinal ligaments already offer poor support or have become stretched due to a pre-existing curve, the added ligament laxity from relaxin may increase the risk of curve progression or instability. Estrogen and progesterone, which rise significantly during pregnancy, also affect the musculoskeletal system. Estrogen influences bone metabolism, muscle tone, and connective tissue health. High estrogen levels can soften ligaments and alter how the spine responds to weight-bearing stress. Progesterone, on the other hand, affects muscle tone, brain signaling, and the regulation of neurotransmitters like GABA, which influence muscle tension and coordination. These hormonal shifts can temporarily change the balance of forces acting on the spine, possibly worsening spinal asymmetry or muscle imbalances in women already prone to scoliosis. Weight gain and postural stress. As pregnancy progresses, women naturally gain weight, both from the growing baby and from increased body fat, blood volume, and fluid retention. On average, women gain 25 to 35 pounds during a healthy pregnancy. This added weight creates a new challenge for the spine, particularly in the lumbar, lower back, and thoracolumbar regions, which must now support more load and maintain balance. For women with scoliosis, this can increase stress on already uneven spinal segments. Additionally, as the center of gravity shifts forward, women instinctively adjust their posture to maintain balance. This typically involves increased spinal extension, arching of the lower back, which can exaggerate existing curves or cause new mechanical pain. If the scoliosis curve involves the lumbar or thoracolumbar spine, this altered posture can place more force on the concave side of the curve, leading to joint strain, muscular compensation, and even inflammation. Over time, this can contribute to postural fatigue, low back pain, sciatica, and curve instability, especially in the later stages of pregnancy. Changes in activity and movement. Another factor that affects scoliosis during pregnancy is the change in lifestyle and activity levels. In early pregnancy, nausea, fatigue, and hormonal shifts often cause women to become less physically active. Later, as the baby grows and discomfort increases, activities like bending, twisting, lifting, and even walking can become limited or altered. These restrictions may lead to reduced core muscle strength, less engagement of stabilizing back muscles, and muscle imbalances, particularly if scoliosis is already present. For women with pre-existing spinal curves, maintaining muscular symmetry is vital to keeping the spine supported. If activity levels drop significantly, or if movement patterns become too one-sided, e.g., favoring one hip while standing or sleeping only on one side, scoliosis-related discomfort may increase. In some cases, reduced movement can even lead to temporary progression of spinal curvature, especially if core support becomes too weak to offset the forces of pregnancy-related weight gain. Nutritional shifts and bone health. Pregnancy also demands significant nutritional changes, many of which influence bone, muscle, and joint health. The growing baby pulls nutrients from the mother's body, especially calcium, magnesium, vitamin D, and protein, to support its own skeletal development. If the mother's diet is not rich in these nutrients, or if absorption is poor due to gut health issues or genetic factors, such as MTHFR or VDR variants, the bones and connective tissues may become weaker over time. Lower bone mineral density, BMD, is already more common in women with scoliosis, and pregnancy can amplify this if not properly managed. Moreover, common pregnancy cravings or food aversions may lead to a diet high in sugar or processed foods and low in essential nutrients. Inflammatory foods can worsen joint pain, increase water retention, and further impair neuromuscular balance, especially in women with spinal curves. Ensuring a balanced, anti-inflammatory diet with enough nutrients to support both mother and baby is a critical part of maintaining spinal health during pregnancy. Postpartum considerations. After childbirth, hormone levels begin to drop, and the body slowly returns to its pre-pregnancy state. However, for many women, especially those with scoliosis, this transition can be difficult. Ligament laxity can last for several months postpartum, and new physical demands, like holding, feeding, and carrying a baby, can place repetitive strain on the spine. If scoliosis-related changes occurred during pregnancy, they may persist or worsen without rehabilitation. It is essential for women with scoliosis to focus on core strengthening, posture retraining, and balanced physical activity during the postpartum phase to avoid long-term spinal problems. The take-home message. Pregnancy is a natural and beautiful part of life, but it brings unique challenges for women with scoliosis. Hormonal changes, added body weight, and shifts in lifestyle and diet can all contribute to spinal stress, pain, or even curve progression. While many women experience only temporary changes, others may notice long-term effects if scoliosis is not monitored and managed. The good news is that with proper prenatal care, personalized exercise, nutritional support, and postural awareness, most women with scoliosis can experience healthy pregnancies while protecting their spine. Understanding how pregnancy impacts scoliosis allows for better planning, early intervention, and a smoother journey through motherhood.